Hi, my name is Dee Dee Delkamp, and I'm here at the Optimal Health Center with Vanessa Teff, and today we're going to talk about digestive health.
How do you decide whether to give someone which enzyme to give, or if they may or may not need a probiotic? Do you do some sort of evaluation, or is it case history, or do you do any functional tests?
Generally, if we would just want to basically start somebody out right away and we don't have time for a test at that moment, I will listen to their symptoms, and if they seem to be having a history where they're having constipation issues, maybe they're having a lot of gas and bloating, possibly they don't feel like they're digesting their food well, or we're seeing a lot of food in stool, then I might just automatically give them a probiotic, because we really need to build up that healthy flora in the colon and in the digestive system. Secondly, as far as an enzyme goes, one of the enzymes we offer has the hydrochloric acid in it. So if it is a person that seems to have symptoms after they eat proteins, possibly, then we would pick that particular enzyme for that person. If the person doesn't eat a lot of proteins, or they're vegetarian or vegan, then I might choose a different enzyme for that person.
Do you have multiple enzymes to use or to choose from?
Yes, we use several different types of enzymes.
If someone wanted to dive into it deeper, what kind of testing would you do?
One of the testings that we offer is hair tissue mineral analysis testing that gives us an idea of how they're digesting their proteins, how they're digesting their carbs. So we can kind of look at that. Digestive issues can come from stress, possibly, so we might offer a adrenal stress index test, or we do have gastrointestinal testing also that we may offer if we suspect that there's a lot of things going on digestively. When we do a gastrointestinal health panel, many times we do see a low SIGA come back on the test. That's a gut immunity that's low. Everything the person is taking in, the body is reacting to in a negative way a lot of times. And so, that would be a good indication for offering an enzyme of some sort, and possibly some other herbs along with that, and probiotics.
Once you're using enzymes, it's kind of more general health, but when people have more specific problems, I know that there are obviously other things to use, other products to use, and one of them is gut flora complex that you've been using.
Right.
And when do you decide to start that with a patient? What kind of symptoms are they having? Or why do you choose that instead of, say, just a probiotic?
Right. I think if they have more chronic issues, if we know that there's definitely possibly some yeast issues, possible parasite issues, they're having a lot of symptoms, constipation, gas, bloating, indigestion, and it's been a long-term type of thing, very chronic for the person, or just more troublesome for the person, then we might try to start using some gut flora.
The number one thing gut flora does for the intestines and the digestive tract is it creates a healthy environment in which for those healthy bacteria, microbes to live.
Right, right. So when you do take a probiotic, it's actually working, because you've conditioned the gut and got it ready for it to utilize that.